Yes?
Hi, Mr. Cantaloupe. My name is Santana. I am actually here to do an abdominal assessment on you. Will that be okay?
Yes?
Perfect. I'm going to go ahead and provide some privacy, and I'm going to do hand washing. Before I begin, Mr. Cantaloupe, can you actually give me your full name and your date of birth, please?
Kevin Cantaloupe, 9/18/1952.
Okay, perfect. So what I'm going to start off with, Mr. Cantaloupe, is if you've had any abdominal pain at any time you've eaten something, or if you're having any pain at this moment. Do you have any?
No.
Perfect. I know this may be a little bit uncomfortable, but this is so I can actually better assess you. Will you give me some information as far as how you normally have a bowel movement, as far as if it's firm, if it's hard, if you are having any diarrhea? Do you have any of those issues?
Well, I don't typically have diarrhea unless I got the flu, and my had a bowel movement this morning,
Okay.
and it was normal, I'd say. It was formed and brown.
Okay, perfect. Do you by chance have, if you've noticed any blood or any mucus in your stool?
No.
You haven't noticed any. Do you take any medications prescribed or over the counter for your any bowel issues?
No.
Okay. Do you by chance have any history of stomach ulcers or GERD, like acid reflux? Any of
No.
that sort? Perfect. I would. I'm gonna actually go ahead and view your stomach. Will that be okay if I move your blanket for you?
Yes.
Perfect. Okay, and I'm gonna go ahead and unzip your jacket. So what I want to expose is your chest and below your stomach into the pelvic region. Right now, what I am assessing for is the skin, which is normally going to be a lot lighter than the actual skin on the arms. I don't see any lacerations. I do notice that the umbilicus is in the center of the abdomen. It is not inverted or everted. Right now, I am on the side of the patient. I am noticing no distension of the stomach, and better assessed would be at the foot of the bed. Also, Mr. Cantaloupe, can you take a deep breath in for me? Perfect. Go ahead and let it go now. Do you by chance have any pain when you have to hold your breath or any of that sort?
No.
Okay, so what I want to do is, if I'm trying to assess if you have any hernias, so what I'm going to have you do is go ahead and hold your breath in, and you're going to make a crunch, lean forward. Can you go ahead and do that for me?
Yep.
Okay. Go ahead and relax now. When a patient does that, normally if it was an inguinal hernia or some type of hernia, that's when I would be able to see it if they were to lean forward for any hernia. For any distension, I would measure at the umbilicus across his abdomen to notice any distension. Also, the breathing is symmetrical. I'm going to go ahead and listen to bowel sounds. Here I have on the right lower quadrant is the most commonly heard at the beginning. This is where you will hear the most active bowel sounds, which is right over the ileocecal valve. And I will stay in this quadrant, the lower right, until I hear a bowel sound, and I'm going to go ahead and move up to the right upper quadrant until I hear a bowel sound. Across the abdomen is the left upper quadrant. And so what I'm listening for is for hyperactive, hypoactive, or normal bowel sounds. And now I'm in the left lower quadrant. Okay, bowel sounds are normal. I am going to go back up to the left upper quadrant over the spleen and the liver. And here I will hear, if any, coarse or grating sounds, which is also known as friction rub. Normally, these are not heard if a patient does not have that. Now, I'm going to go ahead and listen to vascular sounds. I'm going to turn my stethoscope to the valve. Right below the xiphoid process, I am at the aortic. This is where I would be able to hear any bruits. I'm not too sure if I'm pronouncing those right. Should I hear any of those, I would be able, it would possibly indicate an aortic aneurysm. If I move from side to side, I am also listening for renal and iliac. Down at the bottom would be the femoral arteries next to the groin area. I do notice that the umbilicus is centered. Now I'm going to go ahead and palpate using 2 fingers in the right lower quadrant. What I am looking for is a tympani sound. And that completes my abdominal assessment. Mr. Cantaloupe, do you have any questions for me?
No.
No? Perfect. I'm going to go ahead and cover you back up. Is there anything I can do for you before I leave?
No.
Okay, I'm going to go ahead and leave your call light for you right here.
Okay, thank you.
You're very welcome. You holler at me whenever you need me, okay?
Okay, thanks.
Thank you.